Okay. Good to go.
Okay, good afternoon. Welcome to the Health Q&A for today. It is June 18th. My name is Carmen Wabagija-Knuchtai. I'm the Director of Health and Community Wellness for Tikmikshing I do have a panel with me, and this week we will discuss social circles. Also give you an update on the BCR that was passed by Chief and Council with regards to the order and easing of restrictions, and then we'll speak about social circles. So on our panel this week, we have Lisa Grew, who is our home care manager. We have Amanda Wapagishik-Jourdain, who is our health promotions manager. And we have James Boland, who is with Mama West Wing, North Shore Community Health Services Incorporated, and he is their mental health and addictions counselor. So welcome. So many of you might be aware or may not be aware that Chief and Council have updated their BCR with regards to the order. This was completed on June 15th, and with regards to easing of restrictions. Reopening of gathering areas. So the following areas and facilities are permitted to reopen, provided that physical distancing between persons of at least 2 meters, which is 6 feet, is observed. So the following places will be opened in the community, and that will be the rink, the tennis courts, the baseball field, and that's only for training only, so no scrimmages or no games. The field house at the ball field will be open just for washrooms and emergency aid only, no change rooms, and the Whitefish Lake beach areas. We also have the expansion of limitations of the gatherings. Before this, it was a gathering of 5 or less. So now we've increased that to 10 or less. And please ensure that you maintain that 6 feet physical distancing. Now to talk about the border. So the border security, we will be lifting the security for the border security, sorry. So due to the volume of traffic and low risk of transmissions of COVID-19 in the city of Greater Sudbury, Council has decided to remove the border restrictions. The border will remain in effect until 11 p.m. on Friday, June 29th. So Saturday, June 20th, the border will be dismantled and traffic will be allowed to cross without restrictions. The situation will be under constant observation. The border can easily be restored in the event of an increase in health risks to the community or transmission rates in the Greater Sudbury area. So with that being said, I was just advised that there are 2 positive cases in Sudbury. So we are reminding everybody to maintain your 6 feet physical distancing, wash your hands frequently, don't touch your face. And when you have to sneeze or cough, do that in your sleeve or in a Kleenex and shoot that Kleenex out to the garbage right away. That's about it for those updates. So now we're going to talk about social circles and establishing a social circle within your families. And we'll start off with Amanda.
Okay, hi. As we continue our shared fight against COVID-19, social circles are a way to safely expand the number of people with whom you come in contact with. So think about your social circle as the people you can hug and touch, or those who can become part of your daily and weekly routines. You can now establish a family or social circle of no more than 10 people who can interact with one another without physical distancing. People in the same social circle do not have to physically distance, can hug and touch each other, should continue to follow public health advice, including frequent hand washing, and taking everyday actions to help stop the spread of COVID-19. Lisa?
Yeah,
Oh,
one more time
sorry.
from Lisa.
Hi. I'm going to talk about why social circles are important. Close contact with people beyond your household is important to first connect and be close with family and friends outside your immediate household to reduce social isolation, support your mental health and well-being of Ontarians during COVID-19. It also allows for some families to get additional support with childcare, elder care, and other personal needs. As well, it'll allow for more rapid contact tracing in the event of a case of COVID-19 in a social circle. We can trace, isolate COVID-19 quickly and effectively when you limit the number of people that you come in close contact with.
Okay, so create a safe social circle. Follow these steps to create a safe circle. Step 1, start with your current circle. Anyone you live with or who regularly comes into your household. Be sure to include anyone that would come into regular close contact with you and the people you live with. This may be family members, including children, your roommates, another parent to your children or child that lives outside the home, and a babysitter or caregiver. Considerations: if you add people outside of your household to your social circle, be sure to include anyone in their households as well. You may not see them often, but they would still be considered part of your current circle. Remember that everyone in a household must be part of the same social circle.
Okay, James?
Okay, and I'm going to talk about step 2 in that process. If under 10 people, you can add members to your social circle, including another household family members or friend. As you add additional members, you can ask yourself, do they live with or come into regular close contact with anyone else? And you may never see them, but they would still be considered part of your social circle. What makes most sense for you or your household? That could include another household with similarly aged children or family members that you want to spend more time with. Considerations: if you live alone, you may want to start with family members or other close friends. People may or may not choose to participate in a social circle depending on their unique circumstances and risks of developing complications from COVID-19. For example, people that are over 70, people with compromised immune systems, or with underlying medical conditions. Remember that your social circle can include fewer than 10 people. It's always best to start slow and safely add more members later.
Okay, so step 3, get an agreement from everyone that will join the social circle. So that means they agree to join one circle and physically distance with anyone outside of that circle. Essential workers can be part of a social circle, so as long as the other members are aware of the risks and agree to them. Lisa?
Step 4, to keep your social circle safe. To keep people in your social circle safe, you must continue to follow public health advice, including frequent hand washing and sneezing and coughing into a sleeve, and continue to physically distance with anyone outside of your circle by keeping 2 meters or 6 feet apart from them. If someone in your circle feels sick, they should immediately inform other members of the circle, self-isolate at home, and not come into close contact with anyone, including other members of the circle. They should also go get tested. Everyone else in the circle should closely monitor themselves for symptoms of COVID-19. If you believe you have been exposed to COVID-19, you should also be tested.
Okay, so step 5 is to be true to your social circle. No one should be part of more than one circle, and learn about examples of social circles and learn how to create your own in this step-by-step guideline at files.ontario.ca.
So, Yeah, sorry.
So there's a
Yeah.
link you can.
So we do have an insert into the document that we use to guide us in our health Q&As. So if you go to the Ministry of Health website or the Ontario government website, Public Health also has it as well. And you can go into the resource section and you'll be able to find how to build your social circle if you want more information. It will also be circulated in the flyer this week as well. So you can take a look at that in more depth. So now we'll move on to James, and James is going to talk about the new normal of social isolation and addictions, recovery, and mental wellness.
Miigwech. Wabamangan Dishnikas. My spirit name is Grey Wolf, and I'm from Sudbury, and I'm from the Crane clan. So today I had the opportunity to talk about this new normal of social distancing and isolation, and in respect of addictions, recovery, and mental wellness, as Carmen had said. So relaxing of these social distancing rules and guidelines, I'm just encouraging people not to make the mistake to think that the relaxing means that everything is safe. And there's nothing to be concerned with. What's important is that we consider the level of risk now involved in this new normal of socially and physically connecting with others, and continue practicing healthy self-care, as was just mentioned in everything that we talked about, including the hand washing and the wearing of masks, etc. It's also important to consider your recovery in terms of addictions and mental health. The current relaxing of social distancing can and likely will affect people, places, and things. And if anybody's been into one of the 12-step programs with Alcoholics Anonymous or Narcotics Anonymous, you'll have heard that before, because people, places, and things are often contributors to relapses, either in terms of picking up a substance or in terms of behaviors. When you're in different places and with different people and things that can be triggers, your vulnerability can increase. So an important question is, what's your plan? What's your relapse prevention plan? Failing to plan is planning to fail. That's been said over and over many times, and it's important to remember that. If we don't have a plan in place, then we leave ourselves vulnerable. If you haven't developed a plan to maintain your recovery and ensure that your mental well-being is looked after, I encourage you to contact myself or another addiction and mental wellness worker at your health center to help you to develop and build your plan. Know your triggers and make a plan to cope with them, and to reach out for assistance as part of your plan. We don't have to go it alone, and we don't have to do it alone. Relationships, resentments are known to have a big influence on relapse in terms of addiction, as well as your mental well-being. And again, you'll hear that in the rooms quite often. Because the relationships are so important to us, they have quite the gravitational effect and pull on us. Make good decisions for yourself as to where and who you go visit. Exercise your choice to succeed and be successful. Visit your medicine wheel and check in on your balance, physically, spiritually, emotionally, mentally, socially. When we recognize an imbalance in an area, it's an awareness we're gifted with to identify areas where we can apply effort to make change, so that we can improve our well-being and ensure our recovery is maintained. Changes in social distancing, relaxing of these rules, can and likely will have an effect on that ever important structure that you've worked so hard to establish, that helps you to maintain your well-being and your recovery. Take time to consider and prepare yourself to adjust to changes in your structure, ensuring that you don't compromise and that you minimize the potential for adversities or threats to your recovery. Remember that addiction is 10% substance and 90% behaviors. And what I mean by that is, when we look at addictions and we consider the relapse aspect, we say 10% substance, because that's really at the point of regression in terms of our behaviors. They'll regress to the point where we finally end up picking up a substance. So if we focus on the behaviors and what we're doing and our thought processes, that is more than half the battle in terms of not picking up the substance. In recovering from substance abuse, remember that relapse doesn't have to be one of your choices. If it isn't an option, then it won't, and it can't be a choice. And I think that's a really important message, because we have all kinds of choices in front of us, but if we don't have that choice as an option, then it's not a consideration. And that's about really training yourself and implanting that in your mind, so that it isn't something that is an alternative to whatever the situation is. Picking up just isn't something that you want to do. There are numerous other choices that you have available to you to ensure you maintain your recovery and your mental well-being. Doing or going this alone shouldn't be one of them. Pick up the phone and connect with someone. Your strength and your bravery will shine through when you practice healthy and necessary self-care. It allows you to celebrate your humanness. Feeling overwhelmed can cause us to make choices that we normally wouldn't and that we can regret. Remember to play the tape to the end. Now, what I mean by that is, if you are in recovery and and if you get a thought or a trigger about picking up a substance, if you play the tape to the end, what that means is, okay, think about it for a second. What's going to happen if I go and pick that drug up and then I take it and then I get consumed by it and then I wake up the next morning and then I'm full of regret and full of remorse? But if you play that tape to the end, you'll know what the outcome is, and it'll help you to make a better decision as opposed to going and using. Practice KISS, as my good friend Brian Nuchitai says, and I had to throw this in because if you keep it sweet and simple, it really helps. If we allow things to complicate, or we look at things and overthink things, we can really get ourselves into a spiral. But if we keep it sweet and simple, it can really make a difference on our approach. And remember that your focus determines your reality. No one knows or can tell you that they know exactly how you feel right now. I can't. What I can tell you is that I will walk beside you, and I'll support you, and I'll listen to you, and I will work with you to help you find healthy, realistic, and lasting solutions, because your life matters, and what you do next matters. It matters to your family, to your loved ones, to your friends, community members, and most importantly, your life matters to you. Be aware of denial. It comes in many forms: justifying, rationalizing, minimizing, intellectualizing, projecting, avoiding. You know your truth better than anyone, and you are the only one who can challenge the lies of denial to ensure that you make good choices and benefit your well-being and recovery. Remember, pick up the phone, talk to somebody. It's important to consider the effects that we can have on ourselves and on our families, and the pain that we could cause by our actions. Do you consider the 7 grandfathers when you speak or when you act? Are your words and actions kind, considerate, and come from good intent? Once a word is spoken or an action played out, it can't be undone, and its effects can be everlasting. Let's make sure that our words lift ourselves and others, and that they don't crush or deflate. Celebrate your medicine wheel and your humanness. Be good to yourself and to others and to Mother Earth and her bountiful gifts. I hope and pray that you practice the 7 grandfather teachings in all that you do. Chimigwach.
Miigwech. James, that was really nice. And it does, just brings you back that, like for me anyways, my words and, the actions, it really does make an impact on individuals and myself. So always talking nice, saying I love me, talking in the mirror, I love you, also gives you that confidence to keep going. So Miigwech. So thank you very much. I do have one last thing that I want to mention, and it just popped in my head. Testing. So we do have an opportunity, or I don't know if it's an opportunity, but what we can do is we can coordinate some testing in the community if you'd like. If you're interested in that, please send me an email or give me a call, or send Marina a call or an email. And if you would like to be tested, if you don't have any symptoms, or you come across somebody who you think might have symptoms, or you think you're asymptomatic, or you just want to check, they are doing testing on anybody now. And it's not, it doesn't take that long to get the results. and we can do that option for you. So if you're interested, let me know, and I'll be glad to coordinate something like that. Thank you very much, everybody, for joining us for our health Q&A this week. We hope you learned some new information. And again, as always, if you ever have any questions or any concerns with regards to COVID-19, the virus, what we're doing to assist, then please give me a call or one of the panels on today's session, or Marina McCumber. And thank you, and have a great week and a nice weekend. Stay safe.
Right.